Hi, I'm Dr. Jody Schultz of Superior Health and Wellness. Welcome to our office. I'd like to take a moment and show you around a little bit. If you look behind you, you can see we have lots of different pieces of equipment that we utilize with our patients. If you look over here at these chairs, those are called wobble chairs. We utilize these to warm up the spine to get ready for some of the other therapy that our patients are doing. When they get done with that, they'll move to the wall over here and utilize these pieces of equipment on the wall called cervical traction. That warms up their neck to get ready for therapy. When they get done with that, a lot of times they'll move over to the table over here, which is our decompression table. Decompression helps take stress off the nerves and the muscles that are going on in the back. It helps people get a lot of relief from neck and back pain. If you look behind me, this is our link trainer. This helps strengthen different muscles that are weak in people's bodies. This piece of equipment right here is our link trainer. We have our patients utilize this and they do a series of exercises that are going to help strengthen the weaker side of their body. One of the other pieces of equipment that they use is a thoracic roll. This helps break up scar tissue and loosen areas in their back. Okay? This piece of equipment right back here is called our lifespan. This helps, again, strengthen different muscles, but it also helps work on imbalances that their body might have. This is the equivalent of a 30-minute workout in 8 minutes. This is one of our other therapy rooms that we have at the office. In this room, patients will come in here and they'll receive their PTLMS treatment, which is basically like a massage for their muscles. It helps break up scar tissue. It's very loud. It's like a little jackhammer. One of the other exercises that they're going to do in this room is their fulcrums. That's these foam blocks right here, and these are designed to help put the curves back in their spine. It's going to strengthen the muscles that support their spine and help with those curves. Patients may also come into this room where they receive passive therapy like heat and electric stim or ultrasound, which is going to help decrease inflammation and decrease their pain. We also have patients utilize this room for our neuropathy treatment that we perform in the office, the neuropathy DR program. When our patients do come in this room to do hot or cold therapy, we utilize hot packs or ice packs to do that. These hanging up right here are the wraps that we put the hot packs in. Now we use moist heat, so we use pads that are heated up in a hydrocollator that can get as hot as 123 degrees. And we used moist heat because that doesn't dry out the muscles. It actually helps put moisture back into the muscles, which helps the process of healing go faster. This room is one of our treatment rooms. In this room, we can perform chiropractic adjustments and we also can perform exams. Now, the great thing about this room is we can adjust all sorts of different patients. On this table, we have the capacity of moving pieces on it and adjusting pregnant women. Pregnant women can't usually lay on their stomachs, but in here they can. We've also had people who have laid down on our tables and we've adjusted them once and they've gotten tremendous relief. We change people's lives every day in here. This room is our case room. In this room, all of our patients come in here to find out what's going on with them. In this room, we go over everything that is causing their problems and what we would do to correct them. We utilize different tools like the spine and this model of the bones in the spine to educate people. We also utilize x-rays, which you can see behind me, to educate them. We want people to completely understand what's going on before they decide to make a decision about their health care. This room is our medical room. This right here is our medical doctor, Dr. Hartz, and she's the one that performs a lot of our medical procedures. In this room, we do things like trigger point injections, knee injections, and things like that. We also do exams in here. In order to give patients the best care, we want to check them out as thoroughly as possible, and that's what our medical staff helps us do. This room is where we do our x-rays. We take x-rays on our patients if it's medically necessary. This allows us to see what's actually going on inside their body. Unfortunately, we don't have x-ray vision and we can't see into their spine and see what type of problems may have been caused by slips or falls or things like that. So this allows us to get a better picture and a more thorough picture of each of our patients if we find that it's necessary for their treatment.